Hello medicos, welcome to this lecture on shoulder joint. The shoulder joint is one of the most mobile joints in human body, allowing a wide range of motion. This unique structure provides flexibility but also make it prone to injury. In this video, we will explore the anatomy, function and common conditions of the shoulder joint. Let's get into it. Shoulder joint, basically it is a ball and socket joint, and it is classified into a synovial type of joint. Articulating structures, it has pear shaped glenoid cavity and head of humerus. Glenoid cavity is covered by fibrocartilage, and after covering it, it is known as glenoidal labrum. It helps in the deepening the cavity, allowing the movements to be smooth. Now to the capsule. Capsule is attached laterally to the anatomical neck of humerus, while it is attached medially to the margin of glenoidal cavity. Capsule is supported by rotator cuff muscles. Synovial lining. Synovial lining is the lining which lines inner surface of capsule except for the articulating structures. Synovial lining extends as tubular sheet around long head of biceps and deep to the subscapular muscle or subscapular bursa, as we can see in the diagram. This is subscapular bursa and this is long head of biceps. Now the ligaments. Ligaments are very important in any joint as it is a primary support to the joint. The ligaments are 3 in number: glenohumeral ligament, transverse humeral ligament and coracohumeral ligament. Glenohumeral ligament has 3 bands: upper band, middle band and the lower band. Transverse humeral ligament is attached between lesser and greater tubercle of humerus, while coracohumeral ligament is attached to the root of coracoid process to greater tubercle. This we will see in a diagram. So this is coracohumeral ligament, this is upper band, middle band and lower band of glenohumeral ligament, and this is the transverse humeral ligament. This is all primary supports of the shoulder joint. Now there are some additional supports to the shoulder joint. These include coracoacromion arch, known as secondary socket of shoulder joint, and musculotendinous cuff or rotator cuff. This is very important as it is asked many times in exams as short note. Now we will move to it. Relations of shoulder joint. It is very important. The outer covering, it has outer covering while inner covering. Inner covering is known as rotator cuff muscles. So let's get started. This is superior, this is inferior, this is posterior and anterior. Posteriorly there are posterior fibers of deltoid, anteriorly there are anterior fibers of deltoid. Above anterior fibers of deltoid there is one process known as coracoid process, and above posterior fibers of deltoid there is one process which is known as acromion process. Acromion process and coracoid process, in between them there is one ligament which is known as coracoacromion ligament. This ligament is coracoacromion ligament, as we can see. Below coracoacromion ligament there is one bursa in blue color which is known as subacromion bursa. Below acromion process, so it is called subacromion bursa. Now below in under surface there are 4 muscles which are known as rotator cuff muscles, which include teres minor, infraspinatus, supraspinatus and subscapularis. Inside it there is one capsule, and inside which there is one muscle which is known as long head of biceps. Inferiorly there is axillary nerve, one artery which is posterior circumflex humeral artery and long head of triceps. The one which is highlighted in blue is known as rotator cuff muscles. So this diagram is very important, so you all can take screenshot or I can provide notes on Telegram. Nerve supply to shoulder joint. Nerve supply to shoulder joint include 2 nerves, axillary nerve and subscapular nerve. Now the movements and the muscles involved in the movements. There are 6 movements in shoulder joint, which includes flexion, extension, abduction, adduction, medial rotation and external rotation. For these movements there are main muscles and accessory muscles involved in the movements. The main muscles of flexion are pectoralis major, clavicular fibers and deltoid, and the accessory muscles are biceps, short head and coracobrachialis. In extension, main muscles are deltoid के posterior fibers and latissimus dorsi, while accessory muscles are long head of triceps and teres major. Abduction has three parts: 0 to 15 degree, 15 to 19 degree, and 90 to 180 degree. 0 to 15 degree supraspinatus helps in 0 to 15 degree abduction. Middle fibers of deltoid helps in 15 to 90 degree of abduction. Serratus anterior and trapezius के upper and lower fiber help in 90 to 180 degree abduction. Now adduction. In adduction, main muscles are pectoralis major के sternocostal fibers and latissimus dorsi, while the accessory muscles are subscapularis and teres major. In medial rotation, main muscles are subscapularis and pectoralis major, while accessory muscles are latissimus dorsi, teres major, and anterior fiber of deltoid. In external rotation, main muscles are deltoid के posterior fibers and infraspinatus, while accessory muscles are teres minor. Thank you. I hope you understand something from this video and it will make you score good marks if this question comes in exam. Thank you very much. Please subscribe to the channel.